Can chiropractic help children? Well, actually, we see loads of children in practice. Chiropractors are always treating children and babies. Some people are surprised by that because they think of old men who worked all their lives and are worn out needing chiropractic care, which of course they do. But a couple of things. When it comes to babies, if the birth is difficult, and the better condition your spine is, the easier birth tends to be, by the way. But if the birth is difficult and the baby's pulled out by a pair of forceps, when you look at the size of a baby's neck, those delicate tissues, being pulled out of the womb is the equivalent to you having a fairly serious car crash. So if the baby is screaming and crying all day and all night all the time, the probability is it's in pain. Babies cry when they're in pain, amongst other things. And if it's unrelenting, probably in pain all the time. So we can help an awful lot by getting those necks, those little tiny necks, delicately adjusted and back in good condition. Children we see all the time because, of course, they're always doing things. They play sports, they fall off things, they damage themselves, and they complain about their back or their whatever. We see lots of kids with sports injuries, and sometimes they can overtrain the wrong way and damage certain joints or muscles. That we can help with that as well. And the other thing is, and this is my personal bugbear, when I was a kid, at break time, you'd go out and play football or run around, chasing around. Nowadays, you look at a school playground, they've all got these gadgets and they're sitting there doing this, which means their neck's absolutely jammed, they're looking down, they're not getting any exercise, their bones aren't developing to the full extent they should do, and so on. So I think if I were giving advice about children, I'd say that don't let them do that all day long and all night long. Limit it a certain number of hours. Yes, they can go on there, but they have to do some physical exercise as well. In schools, they're made to do a certain amount, but it's really not very much, an hour or two. It's not enough, so you need to do more. And the other thing is, lots of kids have a scoliosis. Now that's where, this is a spine here, where the back curves like this sort of thing. Now, it can come on very quickly during childhood, especially when they go through a growth spurt, maybe the age of 12, 13. It's more common in girls, and it can end up with not just your spine being bent and all the ramifications of that, but also the ribs this side tend to stick out when it turns, which means you have a hump on your back. You really don't want your kids to grow up with a hump on their back. So we check kids for scoliosis all the time. The earlier you find it, the better the chance of getting rid of it. So as they grow, get them checked regularly, see if their spine is straight. If it's straight, great. If it's not straight, let's do something about it while we have the chance. Once the child's about 17 and a half, the spine fuses to its permanent position and you can't change it after that. So get them in early, get them checked, find out what's going on, and all will be well.
I guess one of the best stories I have about chiropractic is about my own family. I've got 2 children, and I'd say it was about 6 months ago I was playing with my son. He was about a year old at the time, and I was just playing around with him, and I picked him up by the back of his overalls, just sort of swinging him around a little bit, and I put him down, and he was wheezing quite a bit, just like an asthma attack. And my wife is also a chiropractor, and she checked down his spine, and sure enough, right in the middle of the thoracics, he had something out. And she laid him down, she adjusted him, and within 20 or 30 seconds, boom, gone. Perfectly fine, running around playing again. It was really amazing to watch. It's one thing to see a success story that takes place over, days, but it was just so dramatic. It was just like that. The light bulb went on. And I guess that's one of the great things about kids. They haven't had all that scar tissue buildup or changes in their spine, so they respond dramatically, instantly. They're great that way.
So that brings us to the end of this video. Thanks for watching. If you have any questions or you're experiencing persistent pain, then please contact us by calling 020 8508 9377. Remember, we're here to help. I'm Samantha. Until next time, thanks for listening.